Hi, how are you?
I'm good, thank you.
Okay, today we're going to be talking about the Medilean program. Medilean is a medical weight loss program and it's made up of three main components. So the first thing is a low calorie diet, the second thing is the HCG injections, and the third thing is your supplements. But we'll go into detail of each of those just now. There's various phases of the program. You can just stop me if you have any questions in between. The first phase is actually the prep phase. During the prep phase, you're basically just preparing the body for what's about to come, and that usually lasts about 2 days. After the prep phase, you're going to go into the detox phase. Detox lasts about 3 days, and then you've got your weight loss phase and your washout phase. So the weight loss phase is where you'll be injecting yourself daily with the injections, and that usually lasts between 4 to 6 weeks, depending on how you feel, and we individualize that per patient. So the washout phase is when you stop the injections, usually for 2 weeks, because your body can become resistant to the HCG. And then you've got your maintenance phase, which is when you've reached your goal weight. We then move you on to the maintenance plan. With each cycle, usually between 6 to 8 weeks, you should lose on average between 1 to 1.5 kilos per week. Okay, so to break it down for you, the low calorie diet is based on the modified Dr. Simeon's diet, and it's basically your meal replacement shake, which you can have as your breakfast, your mid-morning snack, which is generally your fruit, your 2 big meals, which is your lunch and your dinner, made up of a protein portion and a veg portion, and then you've got your mid-afternoon snack, which can also be a fruit, or you can have starch. So that's basically how the diet works. Then you've got your injections that you'll inject yourself daily. HCG is basically a hormone, a growth hormone, that acts on another hormone called leptin. What leptin does is that it regulates your metabolism, and it also works on your appetite to suppress it. Then we've got your supplements. The 4 basic supplements that you will start off with is your CLA. CLA also aids in fat metabolism. Then you've got your omega and CalMag, which you take 2 each at night. These 2 are basically because it's a low-fat diet and you need to replace the good fats. And also you won't be having much dairy, so the CalMag is to basically replace your calcium and magnesium. And then you've got your detox capsules, which you'll only take for the first 2 weeks of the program. Depending on your weight loss, we can then add on a fat burner, which causes thermogenesis and increases fat metabolism as well. Or we can add on Crave Stop, which will then help with your cravings and to suppress your appetite. Before starting the program, we will obviously need to screen you for any medical conditions. There are only 3 absolute contraindications to the program, one being pregnancy. The other is if you've had a previous reaction or allergy to HCG, and the third contraindication is if you've got a history of any hormone-sensitive cancers like breast cancer or ovarian cancer. If you've got diabetes, hypertension, thyroid issues, any of those chronic conditions, then we will have to do bloods for you just to make sure that they are under control, and if they are under control, we can then actually start you on the program. Do you have any questions? Anything that you'd like to know?
Do you have to inject yourself?
Yes, so you'll be injecting yourself daily. You just grab a piece of fat and you inject yourself. It's really not painful. I've been through this process. I've lost 15 kilos on this program, so I believe in it. It does work, and I know exactly how difficult it is and how it feels to go through this. So I can assure you the results will be worth it. A lot of patients also do ask me if they can take the injections alone without following the diet plan. Unfortunately, if you're not following the diet plan and if your calorie intake is higher than it should be, the HCG won't work at all. So it's actually, you're just wasting the injections because it's not going to do anything for you. They both go hand in hand, so you're going to have to do the injections in conjunction with the diet.
Okay.
Sounds good. Let's get started. So we're going to start with your weight, we're going to do an in-body assessment for you, and then we're going to check your measurements. Okay, I'll also be following you up every 2 weeks just to do a weigh-in, check in with you, how you're doing on the program, and then give you 2 weekly booster shots, which is a bit of a high dose of HCG. It also has vitamin B12 and vitamin B coated as well. Okay, so let's get started.